Is COVID-19 back on the rise? Let's talk about it. Welcome to the channel. We want to talk a little bit about COVID-19. It's been a minute since we talked about it. It almost became a hush word for a while because people were so tired of hearing about it coming into and out of the pandemic. Well, unfortunately, it's back. Or should I say, it really never left. But we're experiencing another spike in the incidence and the number of people who are showing up at the hospital with COVID-19. Many of them thinking they've got other issues. A lot of what the new variant is showing up with is severe headache, extreme fatigue, and symptoms that are consistent with allergies or sinuses, nasal congestion, rhinorrhea, facial pressure. They think they have a sinus infection, show up, we test them, they have COVID-19. We're not seeing as much, at least at this point, with respect to the respiratory distress and pneumonia caused by COVID-19. It pops up intermittently, but for the most part, it's more upper respiratory tract type symptoms. Well, why are we seeing so much? Well, the newest variant seems to have found a way to get around both the natural immunity that we've developed from the previous strains of COVID-19, as well as the vaccinated immunity that was given to us by those vaccines. As a result, they've come out with a new COVID booster, which they're recommending again for high-risk patients. Patients over the age of 65, those with comorbid medical conditions like chronic lung disease, diabetes, heart disease, and even certain cardiovascular conditions like hypertension and peripheral vascular disease, put you at a higher risk of having severe illness should you contract this new variant of COVID-19. If you've already had all of your immunizations, including your booster with the previous strain, and you're not in one of those categories, then you don't need to necessarily get a new booster. However, even if you have had your booster with the previous strain, and you're in one of those high-risk categories, the CDC is recommending that you go ahead and get the new booster, and it's now out in your pharmacies. You can still get it for free, just like the previous one. There's really no reason why you wouldn't want to protect yourself to the greatest degree possible. If you have questions, hit us up in the channel. I'd be glad to correspond with you. I hope you like the content that we're putting out. If not, I would sure appreciate if you would send us some questions. Ask us what it is that you'd like to talk about, and we'll be sure to put it on the channel. In the meantime, if you are enjoying it, hit that like button. Make sure that you subscribe so that we can be in contact with you early when we put out new content, and also hit that bell notification for the same reason so that you'll know when there's something new on the channel. It may answer one question that you haven't asked yet, and we'd like to have that conversation with you. Give us some feedback.